Hi, my name is Danielle Summerall, and I'm doing my report on rickets and osteomalacia. Rickets and osteomalacia, a vitamin D deficiency disease, both which are from not getting an adequate amount of calcium in your bones. Rickets is in babies and children, and osteomalacia is in adults. Rickets is the failure to mineralize a new formed osteroid. It was medically described in the mid-17th century by Whistler, an Englishman who was studying in Leiden at the time. Both a Dutchman who was working in Dublin at the time, and Glisson, a member of the Royal College of Physicians located in England. Symptoms include enlarged rib cage, head and joints, deformed pelvis, and bowed legs. A nuclear steroid hormone receptor, VDR, is a receptor that gives a rise to the severe rickets if there are mutations running in it. Mutations in the receptor can lead to a change in the DNA, binding dominant leading in the binding of clitical, which then causes the rickets. Growth, body compensation, and biological events are the three main components of development which are very relevant to rickets. The presentation, etiology, and effects on the child's body depends on the mother's genes, developmental stage, and environment. There are four developmental stages in which rickets is found: low birth weight babies and preterm infants, young infants, older infants and toddlers, and at puberty level. In low birth weight babies, the most abundant disturbances have been from the infants receiving low mineral diets. Examples included is unsupplemented human milk. A way to fix this would be by using minimal enriched milk formula. The next age is young infants. This stage is closely related to the status of mother's vitamin D status. Hypoglycemia and rickets contribute to an inadequate amount of vitamin D in pregnant women. In the third stage, older infants and toddlers, the simple cause of having rickets is a vitamin D deficiency. But when in a sunny climate, a calcium deficiency is achievable, which could be from drinking little to no milk. In infancy, it could be viewed as deformity, delayed walking, irritability, and intermediate muscular spasms and seizures. In this stage, bowed legs is a familiar reason to send the child to be viewed by an orthopedic surgeon or his or her pediatrician. The last developmental stage, puberty, has a couple factors that contribute to rickets. Sunbathers and sports enthusiasts are at high risk because they have a greater amount of exposure to sunlight. Symptoms will include leg deformity, carpal spasms, and limb pain. Prevention is the key. While there are the obvious ways of preventing rickets, sunlight, diet, calcium intake, and significant amount of phosphorus, there will also be more complex methods which can vary by situation because of the socioeconomic factors. Vitamin D supplements can be given to all older toddler and school-aged children until after puberty. Growth spurt. Unless the child's pediatrician doesn't suspect that the child has a lack of vitamin C or vitamin D, a requirement of diagnosis, which is a radiograph of a long bone showing that the cupping, fraying, and splaying of the metastasis and biochemical abnormalities are assessed as clinical signs of rickets. Treatments of rickets vary by case, but they involve adding vitamin D and or calcium to your diets, as well as medications or a possible surgery for fixed abnormalities. Some children can be successful treated with a large amount of calcium. Osteomalacia means soft bones. It is characterized by poor calcification of a newly synthesized bone. It is the adult vitamin D deficiency version of rickets. Be sure not to get osteomalacia and osteoporosis confused. They are similar, but osteomalacia is the bone not formed yet or in the forming process, and osteoporosis is the weakening of a bone that is already formed. Fractures of the hip, spine, and other bones are results from poor calcification of newly synthesized bones. Adults who have a kidney disease, liver disease, or both, or ones who have an intestinal disease that impairs fat absorption and are more likely to get osteomalacia because of their low vitamin D levels, from low dietary intake and their limited kidney function, which limits alteration to the active form of vitamin D. Adults that are dark-skinned and have very little UV exposure and older adults that live in nursing homes are also at higher risk for osteomalacia. A mother who has osteomalacia and does not know it yet gives her baby a low amount of vitamin D. Her breast milk doesn't provide enough of vitamin the baby needs, and vitamin D supplements are not taken since it's undiagnosed. Symptoms for this disease include, but are not limited to, easy fracturing of bones, weakness of the muscles, and bone pain, especially in the lower back, ribs, pelvis, and legs. Treatment for this disease is very similar to treatment of rickets. If caught early enough, vitamin C and vitamin D can be added to your diet and daily routine. If not caught early enough, surgery and additional medications may be added. Rickets and osteomalacia are very similar in treatment, symptoms, and description are from not having enough vitamin D in your body, but rickets is in infants and osteomalacia is in adults and geriatric age. Thank you.